have a look at this clinical question. Now, this is a much more challenging question, okay, because we're actually testing more than just the interpretation of the number, but also the broader picture, okay? And this is one of the things for those of you that are going to sit the MRCGP AKT, for example, that some of the high challenge questions, there may be some really important keywords that if you spot them or don't spot them could make a difference, even if you've got a broad knowledge of the overall topic. So two really important things here. The first is that this patient is of South Asian heritage, okay? Now you see the body mass index of 24, in and of itself, if the patient wasn't South Asian, then this wouldn't be something that we'd be worried about. It's still within the healthy range, isn't it? Okay. And then we've got the waist to height ratio. Now, you already learned how to calculate that. So you're going to do 90 divided by 160 to get the waist to height ratio. That's 0.56. So we talked about that. That suggests increased central adiposity, increased risk. Now, at what category does this BMI place this patient? Are they in the healthy range, overweight, obesity 1, obesity 2, or obesity 3? That's the broader thing that's being tested here, right? Now, if you read all the numbers, knew how to do the calculation, but missed this bit, then you might think, okay, that's a healthy weight. They have got slightly increased central adiposity, so there is some increased risk there. And that's actually what happened. The most popular answer, most of you picked C, healthy weight with central adiposity, increased risk. But the correct answer is actually F. This patient is classified as overweight. And that's because he's from one of the ethnicities that the guideline specifically mentions are known to have increased risk. Okay, mostly that's genetic, but there are other factors. So South Asian is one of those. And for those, the thresholds actually, when we classify someone as overweight, obese, obesity 2, obesity 3, they drop. Okay, so this patient is actually in the overweight range. Okay, he's not quite obese. Anyone know the threshold where obesity 1 kicks in for a patient of South Asian heritage? Type into the chat. Obesity 1 kicks in at 27.5. It's 2.5 reduced compared to normal, because most patients, it'd be 30, wouldn't it? So you take 2.5 away from that. So they're not obese yet, but they are overweight. They have got central adiposity because this is raised, okay? It's above 0.5, but it's not 0.6. So they have got increased risk. That's why the correct answer is F. It's a very high challenge question. Hope you found that helpful. Please do subscribe to the channel, like and share with your colleagues if you'd like more content.